We are now going to look at Chapter 49, Care of Patients with Eye and Vision Problems. This chapter looks at conditions affecting vision, which can occur gradually, such as cataracts, but others can result from an acute insult or illness. Even with temporary reduced vision, changes in function or lifestyle can result. First thing we're going to look at is eyelid disorders. Eyelid problems can be related to changes in the structure, function, or position of the eyelid and may be impacted by aging. Blepharitis is an inflammation of the eyelid edges and occurs most often in the older adult and those with dry eye syndrome. Blepharitis is controlled with eyelid care using warm, moist compresses, followed by gentle scrubbing with dilute baby shampoo. Entropion is the turning inward of the eyelid, causing lashes to rub against the eye, caused by muscle spasms, scarring, and deformity from trauma or aging. Surgery corrects eyelid position by either tightening the orbicular muscles and moving the eyelid to a normal position, or by preventing inward rotation of the eyelid. An ectropion is the turning outward and sagging of the eyelid, which often occurs with aging, caused by relaxation of the orbicular muscles. This reduces the washing action of tears, leading to corneal drying and ulceration. Hydrodium is an infection of sweat glands in the eyelids, where the eyelashes exit from the eyelid, resulting in redness, swelling, and tenderness. Treatment includes the use of warm compresses and an antibacterial ointment. Chalazion is an inflammation of the sebaceous gland in the eyelid, beginning with redness and tenderness, followed by a gradual painless swelling at the gland. Treatment includes the use of warm compresses and ophthalmic ointment. We're now going to look at entropion versus ectropion, and I have two pictures here for you to see. Now, an entropion is the turning inward of the eyelid, causing the lashes to rub against the eye. It can be caused by eyelid muscle spasms or by scarring and deformity of the eyelid after trauma. It occurs often among older adults, again because of age-related loss of tissue support. Patients typically report feeling something in their eye, pain, and tears may also be present. You'll see that the eyelid is turned inward and the conjunctiva is red. Corneal abrasion may result from the constant irritation. Surgery corrects eyelid position by either tightening the orbicular muscle and moving the eyelid to a normal position, or by preventing inward rotation of the eyelid. After surgery, the eye is covered with a patch and the patient is discharged a few hours later. Ectropion is the turning outward and sagging of the eyelid, which often occurs with aging, caused by muscle relaxation or weakness. This lid position reduces the washing action of tears, leading to corneal drying and ulceration. Patients often have constant tears and a sagging lower eyelid. Surgery can restore lid alignment. After surgery, the eye is covered with a patch and the patient is discharged. Nursing care is the same as for an entropion. The lacrimal system moistens the eye surface with tears and removes tears from the eye. Problems arise from reduced tear production, infection, or inflammation in the lacrimal system. Keratoconjunctivitis sicca, or dry eye syndrome, results from changes in tear composition, lacrimal gland malfunction, or altered tear distribution. Drugs, such as antihistamines, beta-adrenergic blocking agents, and anticholinergic drugs, also can reduce tear production. Diseases associated with decreased tear production include rheumatoid arthritis, leukemia, sarcoidosis, and Sjogren's syndrome. Radiation or chemical burns to the eye also decrease tear production. Injury to cranial nerve 7 inhibits tears. Eye dryness may follow vision-enhancing surgery. Dry eye syndromes are much more common in women than men. Treatment depends on symptom severity. Restasis eye drops may be prescribed to increase tear production. Artificial tears also can be used to reduce daytime dryness. And a lubricating ointment is used at night. If the dry eye syndrome is caused by an abnormal eyelid position, surgery may be needed. Now we're going to look at conjunctival disorders. The conjunctiva is a thin mucous membrane that covers and protects the eye. Conjunctival blood vessels are fragile and can break with increased pressure during sneezing, coughing, or vomiting, or with hypertension, trauma, or clotting disorders. Inflammation occurs from exposure to allergens or irritants and is not contagious. Trachoma is a chronic bilateral scarring form of conjunctivitis caused by chlamydia and is the chief cause of preventable blindness in the world. Conjunctival hemorrhage is a small, well-defined area of bright red hemorrhage under the conjunctiva. Typically, the patient does not have complaints of pain and no visual impairment. It usually resolves in 14 days without treatment. The conjunctival blood vessels are fragile and can break with increased pressure during sneezing, coughing, or vomiting. Hemorrhages may also occur with hypertension, trauma, or blood clotting problems. Patients are often typically concerned about the appearance, even though they do not have pain. Again, it does resolve within 14 days, usually without treatment. Now we're going to look at conjunctivitis. It's an inflammation that occurs from exposure to allergens or irritants, and it is not contagious. Infectious conjunctivitis occurs with bacterial or viral infection and is contagious. So to clarify, infectious conjunctivitis is contagious versus allergic conjunctivitis is not contagious and comes from allergens or irritants. With allergic conjunctivitis, manifestations are edema, a sensation of burning, a bloodshot eye appearance, excessive tears, and itching. Management may include corticosteroid eye drops. It is important to teach women to avoid using makeup near the eye until all symptoms have subsided with allergic conjunctivitis. With bacterial conjunctivitis or pink eye, it's typically caused by Staphylococcus aureus. Manifestations are blood vessel dilation, mild edema, tears, and discharge. The discharge is watery at first and then becomes thicker with shreds of mucus. Drug therapy with topical antibiotics is prescribed to eliminate the infection. Nursing interventions focus on preventing infection spread to the other dry or to people. Encourage patients to wash their hands, discard any makeup, and avoid sharing washcloths and towels with others. Trachoma is a chronic conjunctivitis caused by chlamydia. It scars the conjunctiva and is a common cause of preventable blindness worldwide. The incidence is highest in warm, moist climates where sanitation is poor. The incubation period is 5 to 14 days, and at first the disease resembles bacterial conjunctivitis. Manifestations include tears, photophobia, and eyelid edema. Follicles form on the upper eyelid conjunctiva. As the disease progresses, the eyelid scars and turns inwards, causing the eyelashes to damage the cornea. Cultures are used to identify the causative organism, and a 4-week course of oral topical tetracycline or erythromycin is usually given. Nursing interventions focus on infection control, teaching patients to wash their hands before and after touching eyes, to keep washcloths separate from those of unaffected people, and to laundry them separately. Now we're going to look at corneal disorders. Corneal problems may be caused by irritations or infection with ulceration of the corneal surface, degeneration of the cornea, or deposits in the cornea. Corneal problems reduce refracting power of the cornea and can lead to blindness. A corneal abrasion is a scrape or scratch of the cornea that disrupts the integrity of the structure caused by a small foreign body trauma or inappropriate contact lens use. Bacterial, protozoal, and fungal infections can lead to corneal ulcerations, which is a deep disruption of the corneal epithelium extending into the stromal layer. The patient usually has pain, reduced vision, photophobia, and eye secretions. It's important to stress the importance of applying the drug as often as prescribed and even at night for taking care of these issues. Keratoconus is degeneration of the corneal tissue resulting in an abnormal corneal shape and can occur with trauma or may occur as part of an inherited disorder. Treatment for permanent corneal disorder that obscures vision is aimed at restoring corneal clarity and enhancing the patient's ability to use the remaining vision. Keratoplasty or corneal transplant is the surgical removal of diseased corneal tissue and replacement with tissue from a human donor cornea. For misshaped cornea that is still unclear, surgical management involves a corneal implant that adjusts the shape of the cornea. The device approved for this procedure is the Intacs corneal ring. Cataracts. A cataract is an opacity of the lens that requires surgery for correction. And we're going to look further at that on the next slide. So cataracts is an opacity of the lens that requires surgery for correction. With aging, the lens gradually loses water and increases in density. This increased density occurs as older lens fibers are compressed and new fibers are produced in the outer layers. Lens proteins dry out and form crystals. As the density of the lens increases, it becomes opaque with the painless loss of transparency. Both eyes may have cataracts, however the rate of progression in each eye is usually different. When vision is reduced to the extent that activities are affected, the surgery should be performed as soon as possible. Most patients experience a dramatic improvement as early as a day of surgery. For postoperative care, the nurse should review the complications of sharp, sudden eye pain, bleeding or increased discharge, lid swelling, decreased vision, and flashes of light or floating shapes with the patient and family before discharge. Antibiotics are given. The eye is unpatched, and dark glasses are typically required. They should expect mild itching to be normal, and pain typically indicates complications. The next thing we will look at now is glaucoma. It's a group of ocular diseases resulting in increased intraocular pressure. A normal IOP requires a balance between production and outflow of aqueous humor. If the IOP becomes high, the extra pressure compresses retinal blood vessels and photoreceptors and their synapse nerve fibers. The compression can result in tissue ischemia and lost sight. Tissue damage usually starts peripherally and moves inward. Glaucoma is usually painless, and the patient may be unaware of gradual reduction in vision. Primary open-angle glaucoma is the most common form of primary glaucoma. It's usually bilateral and asymptomatic in the early stages. Angle closure glaucoma, also called closed-angle glaucoma, narrow-angle glaucoma, or acute glaucoma, is less common, has a sudden onset, and is an emergency. Blindness from glaucoma can be prevented by early detection, lifelong treatment, and a regime of close monitoring and follow-up care. Visual fields are measured to determine the extent of peripheral vision loss. The visual fields first show a small defect that gradually progresses to a larger field defect. Visual field testing by perimetry is performed, and medications and surgeries are available to help the patient with this. Drug therapy for glaucoma focuses on reducing IOP through constricting the pupil so that the ciliary muscle is contracted, allowing better circulation of the aqueous humor to the site of absorption, and reducing the production or increasing the absorption of aqueous humor. Patient teaching includes educating the patient how the eye drops work, how to administer the medication, monitoring for side effects, and compliance. Most eye drops cause tearing, mild burning, and blurred vision for a few minutes after installing the drug. The sclera may also become red and itchy. Priority nursing interventions for the patient on drug therapy for glaucoma is teaching. Drug therapy is achieved only when the drugs are used on the prescribed schedule. Teach patients the importance of instilling the eye drops on time and not skipping doses. It's also important to teach patients to wait 10 to 15 minutes between drug installation to prevent a washing out of the previous drug, and stressing the need for good hand washing, keeping the eye drop container tip clean, avoiding touching any part of the eye with it, and also teaching the patient to put pressure on the cornea of the eye near the nose immediately after eye drop installation to prevent systemic absorption of the drug. Other eye disorders include macular degeneration, is the deterioration of the macula in the area of central vision and can be age-related or exudative. Treatment aims to help the patient maximize remaining vision to maintain the ability to read, write, recognize safety hazards, and drives. Dry age-related macular degeneration has no cure. Management of dry AMD is focused on slowing the progression of the vision loss and helping the patient maximize the remaining vision. So we will pick up the rest of the slide and start talking about refractive errors in the next video.